Examination of the shoulders. Humerus heads. I say, Tommy. Giving old Betsy a good seeing to, are we? Oh my word! It seems, like many working with elevated upper limbs, you have contracted an injury of the shoulder. So, let us remind ourselves of the routine underlying examination of the shoulders. Humerus heads. Exposure. After washing your hands and explaining the situation to the patient, ensure the shoulder joints are adequately exposed. Inspection and palpation. Observe the shoulders for symmetry, scars, skin changes, deformity, and muscle wasting. Briefly test sensation over the regimental badge areas. Anesthesia indicates axillary nerve damage. Don't forget to look at the biceps muscle for Popeye's sign, indicative of a ruptured long head of biceps tendon. Inquire about pain and then feel for joint temperature. Terrific, Tommy. Bony prominences, joint lines, rotator muscles, and the scapulae should be palpated whilst looking at the patient's face. Movement. Begin by asking the patient to copy this movement to test active abduction. If normal range of movement is reached, there may be no need to test this passively. Be sure to feel for crepitus and observe the ipsilateral scapula as the movements are made. Recall, Tommy, that a painful arc is characterized by pain from 10 to 120 degrees. Super, Tommy! Now test for active adduction. Flexion, extension, finishing with external rotation. You may also test movements passively. Note that normal external rotation of 70 degrees is lost in adhesive capsulitis, or frozen shoulder to you, Tommy. Spiffing, Tommy. Ask the patient to copy the following movements to assess function of the joints. Note the vertebral level reached posteriorly. Normal shoulders allow patients to reach T4. Now ask the patient to press against a nearby wall with straight arms and flat palms. Observe for winging of the scapulae. This indicates ipsilateral long thoracic nerve damage. You will encounter this sign in certain mastectomy patients. After thanking the patient and re-washing your hands, state that you would examine the joints above and below the shoulder, and the neurovascular status of the upper limbs. Now present your findings concisely, Tommy. You could perhaps say that Ms. Johnson is comfortable at rest, with no abnormalities on inspection. Range of movement is full in all planes, however, there is pain on abduction through 10 to 120 degrees in the left shoulder. This suggests painful arc syndrome, or supraspinatus tendinitis. Well, Tommy, I hope those painkillers help you crack on with giving Betsy a good service. And, whilst you do, take heart from the knowledge that never again shall you be flummoxed when performing an examination of the shoulders. Humerus heads.